I'm Dr. David Hill, and today we're going to talk about how to treat sinus infections in babies. Now, one of the hardest things to know is when does a baby have a sinus infection? There's been a lot of research on this, and it's not at all easy to tell. We do have some guidelines, though, that help us figure out who might benefit from antibiotic treatment and who might not. Sinus infections usually start as a viral upper respiratory infection, what we'd commonly call a cold. And the virus gets into the upper airway. It infects the nose and the sinuses and even the back of the throat, and sometimes the lower airway. It involves the lungs and the bronchi as well. And this is terribly common in babies, toddlers, and preschoolers. The average toddler is going to get 8 to 10 colds a year. So how do you know if your child has a fever and a runny nose and a cough and a stuffy nose? How do you know whether that's a sinus infection or not? Well, there are a few clues we have. Number one is fever. Fevers with a viral infection we think generally are under 104 degrees. When you see a fever going over 104 degrees, you're going to want to see if the child can see their doctor in the next 24 hours. Over 105 degrees suggests perhaps an even more serious infection, and you want to get your child seen as soon as possible. Remember, the fever is not going to hurt the child, but it is a clue that something important may be going on, and we're probably going to want to check that out. Number two is how long does the fever last? A fever with a cold usually lasts for about 3 days. If the fever is going on more than 3 days, that can suggest a bacterial infection that may benefit from antibiotics. Third is how long do the symptoms last? If cold symptoms are going on more than 10 to 14 days, we think that the viral phase of the illness is probably over, and we may have moved into a more bacterial phase. So that's something you're going to want to get checked out with the child's doctor. So, what do we do if we think there is a sinus infection? The basics are still antibiotics. Most of us will start with amoxicillin at 80 to 90 milligrams per kilogram per day. That's the dosing. If the child hasn't recently had amoxicillin or doesn't have an allergy to amoxicillin. Beyond that, there are several other choices for second and third line antibiotics in more complicated cases, but that's something you're going to want to go over with your doctor. If your child has been on antibiotics for 3 days and has not improved, that's time to call your doctor back, because we think by then the antibiotics should have helped. So check in and see what else might need to be done. Talking about treating sinusitis in babies, I'm Dr. David Hill.